We'll turn to Alabama now, where the Delta variant cases are spiking, but suddenly so are vaccinations. Alabama still has the lowest vaccination rate in the country, but the CDC reported a 63% rise in the number of residents getting vaccinated last week. That is so hopeful. It came after the state's Republican governor, Kay Ivey, tore into Alabama's unvaccinated population, saying they were to blame for the rise in cases. Let's bring in Professor of Medicine and Infectious Diseases and Virology at the University of Alabama at Birmingham, Dr. Michael Saag. He has a new op-ed in the Washington Post entitled "Delta is Worse. This time around, Alabama is facing a two-front war." Dr. Saag, what is the two-front war?
Well, the war, first off, is against the virus, and we've just been talking about that for the last 2 minutes or so. The second war is against misinformation. And that's the reason why a lot of people aren't getting vaccinated. I had a patient just this week on Friday who came in sick with COVID, and I said, "Have you gotten vaccine?" He said, "No." But I was thinking about it. I said, "Well, what kept you from getting it?" He said, "Well, I was about to get the Pfizer vaccine, and then I read that there were all kinds of problems with the Pfizer vaccine, so I hesitated." I said, "How do you feel about that now?" He said, "I wish I'd gotten it." That's the war we're fighting. It's two fronts. It's the virus and it's misinformation.
And where do you think they're getting the misinformation? What are you hearing from patients as to where they're getting this information that is dead wrong?
Yeah, a lot of it's coming off of social media. I think Facebook in particular, I'm not trying to throw them under the bus, but there is just anything can be posted there. And if to get into a link or a groove of information coming at you, there's no way to really validate it. So people read it, they get scared, and they say, maybe I'll wait a little longer. We can't afford that anymore. We have to have trusted voices, not get assassinated in social media, so that when people come on TV or they write op-eds or whatever they do, the people will listen and they have a source of solid information. We really need that in a big way right now.
When you have a family member who is on Facebook all the time, if you could just tell them what the doctor just said, anything can be posted there, and anything is. It's not news, it's not facts, it's not a good place to get information. Try and save their lives. Doctor, do you think what Kay Ivey, the governor, did by coming out strongly against the unvaccinated and really making a push for vaccines has helped in terms of public health, has helped turn the tide toward more people getting vaccines?
I think it was a very important step, but I think also the numbers are kind of scary to people. In May, 18,000 deaths in the United States, 17,850 of those were among unvaccinated people. The vaccines work. And people are seeing friends and relatives getting sick, some going into the ICU. And as you said earlier in the program just now, the kids. In Children's Hospital here in Alabama, we didn't have hardly any cases in the last wave of children going into the hospital with COVID pneumonia. Now we have 27 in the hospital and 5 or 6 in the ICU. We didn't see that before. And as you said earlier, with kids going back to school, which I want to see happen, to send them in without masks is like sending kids out into a car without a car seat. This has to be done. We have to find a way to protect kids. If we want the privilege of sending them to school, we have to have protections for them, in my opinion, right now.
So with kids, so many kids, you've got to be incredibly concerned. What do you think of a state governor banning mask mandates specifically in school right now in a state like Florida?
I think it's governance malpractice, frankly. You have to be able to give the people in the school systems, the counties, the authority and the ability to do what they think they need to do to protect kids. Why take that away? I cannot imagine, outside of political motivation, there's no public health reason to do that. In fact, it's the opposite. So I think we have to sit down and drill into the Florida governor's ban on that and ask the question, why? There's no medical reason. It can only be politics, and he's playing to his base, and I think he probably has a lot of future political aspirations. What's it costing the state of Florida to follow that? In contrast, Governor Ivey's getting out in front and doing the right thing.
Hey, Doctor. Good morning. It's Jonathan Lemire. We just talked about there's a hopeful rise in the vaccination rates across the state. But we are, of course, hearing from people who have gotten to the hospital, heartbreaking stories, who have gotten there and then asked for the shot and, of course, are being told it's too late. You have to go on a ventilator, and people are obviously in very dire shape. You just mentioned something I want to circle back to about children. Can you walk us through just in terms of the different populations of people you're seeing be seriously ill this time? Is it indeed skewing younger? Tell us how sick are these children, but also just the range of people that you're seeing there. It's not senior citizens anymore. These are younger folks.
Yeah, they are, Jonathan. The bottom line is that the older folks are kind of wise, right? They got vaccinated, so 80% are vaccinated. We're not seeing them in the hospital. The vaccine works. We're seeing 20-year-olds, 30-year-olds, 40-year-olds coming in. That's the majority of our cases, and of course the few in that 20% who were not vaccinated are the ones having problems. And so we're seeing the vast majority of cases are in young adults and mid-level adults. The difference in the kids is striking simply because we didn't see it before, and we're seeing it now. And that's what has all of us sort of jumping back a little bit and saying this could get bad. The other thing that I'd like to emphasize is that there was a study by Dr. Suzanne Judd here at the School of Public Health, and what she showed was that using projections and the slope of the curve, by Labor Day, we will have 2 to 3 times the number of cases in Alabama overall than we saw at the peak, the worst time, in January 2021, 2 to 3 times. And that's all, in my opinion, coming back from July 4th, when everybody went out, sparked a flame. Now we have a wildfire.
So we are seeing, Doctor, some prominent voices in your state. The governor, football coach Nick Saban, he's been outspoken throughout this pandemic about the need to mask up and then get the vaccine. But what are you seeing at more of the local level? Can it make a difference? Are you hearing from ministers, clergymen, local leaders? Are they also speaking out against this? We've talked on the show a lot about the evangelicals and how some have been raging against the vaccine while others have struck a note recently, like saying, look, this is important, you need to do it. What are you seeing anecdotally in your communities about who's pushing for the vaccine, who's opposing it, and what difference is it making?
I think it's kind of a all-fronts approach. You're right. The folks like Nick Saban coming out strongly in favor, I think, helps. But at the end of the day, I think it's a one-on-one conversation that people have as they're getting to the point where they're thinking about really going in and getting a vaccine. It could be a clergy. It could be, a lot of times, their physician or their provider who says it's really important. I do that in my clinic all the time, and it's amazing how just a few words of encouragement, answering a single question, and the next day or even that day they're going out and getting their vaccine. So it's one-on-one conversation. Sometimes it's family. I've heard tragic stories of where someone has died in the family, and the surviving son or daughter says to the parent, "You're not going through this. I'm going to make you get the vaccine. You don't have a choice," because it takes that kind of tragedy and it's boiling out one-on-one. That's how we're seeing people changing their minds. But everyone needs to pull together in the same direction. That's what we need right now, and it's urgent.
Professor of Medicine and Infectious Diseases and Virology at the University of Alabama at Birmingham, Dr. Michael Saag, thank you very, very much. And